The first here we have the calvaria. When we assess the internal feature of the calvaria, at this area we see superior, we see a groove which is named sagittal groove. It is for the superior sagittal sinus. We have some vascular marking groove for the meningeal, and also at this area we have some small fossa which are named granular fovea. After calvaria, when we assess the superior view of the base of the skull, we see cranial fossa, anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. The specific features in the anterior cranial fossa. The first, at this level, I have frontal crest. Here, crista galli. Between these two them, we have foramen cecum at this area. Lateral to crista galli, we have two groove. Olfactory groove for olfactory bulb. Here, we have orbital plate of frontal bone, which frontal lobe of the brain locates at this area. Then, from the sphenoid, at this area, we have ethmoidal spine of sphenoid. Here is named jugum sphenoidal at this area. Also, lesser wing of sphenoid. Here is lesser wing of sphenoid. They are the structures in the anterior cranial fossa. It is better. Another again, lesser wing of sphenoid, jugum, and ethmoidal spine. In the middle cranial fossa, I see this structure. In the median part, here, at this area, look at here, we see a small groove which is named optic groove. Look at here, it is named optic groove or sulcus chiasmatic. Lateral to optic groove, we have optic canal at this area, optic canal. Optic canal is located between anterior root and posterior root of lesser wing. It is lesser wing. Between anterior root and posterior root, we have optic canal. Also, posterior root of lesser wing made anterior clinoid process. Here is anterior clinoid process. This area is named to sella torsica. Sella torsica, anteriorly we have tuberculum sella, posteriorly we have dorsum sella. These tubercles lateral to dorsum sella are named posterior clinoid process. These tubercle lateral to tuberculum sella are named middle clinoid process, and they are anterior clinoid process. This deeper part is named hypophyseal fossa for hypophyseal gland. Here, at the lateral part of the body of sphenoid, we have a groove, carotid groove, which internal carotid artery from foramen lacerum, here is foramen lacerum, insert to carotid groove and travel anteriorly. After carotid groove, here at this level, you can see the border of the greater wing of sphenoid. Here, in the greater wing of sphenoid, we have three foramen. Here, foramen rotundo at this area, foramen ovale here and here, and foramen spinosum at this area and also in this area. Also, when the apex it is petrous, here is petrous, here is squamous part of temporal bone, petrous part of temporal bone. When the petrous attached to posterior part of the greater wing of sphenoid, this foramen is named foramen lacerum at this area. Another part, in the anterior surface of petrous, you can see these features. The first, here, at this level, you can see the trigeminal impression. After trigeminal impression, here you can see two groove for greater petrosal and groove for lesser petrosal nerve. Here at this area, you can see an eminence, arcuate eminence, and lateral to arcuate eminence, here is tegmen tympani. They are the structure in the anterior surface of petrous, which are located in the middle cranial fossa. Another structure are this groove. This is groove for accessory, groove for middle meningeal artery at this area, because It arrived to foramen spinosome. Yes, groove for middle meningeal artery. They are the structure at this area in the middle cranial fossa. Also, in the posterior cranial fossa, you can see the clivus of sphenoid. Here is clivus of sphenoid. Here is clivus of occipital. Which clivus of occipital is the same superior surface of basilar part. So it is basilar part. Here is foramen magnum. Lateral to foramen magnum, we can see two tubercle here in two parts. In the right and left side, which are named jugular tubercle. Jugular tubercle covers hypoglossal canal. Hypoglossal canal is located below jugular tubercle in the posterior cranial fossa, and at this level, jugular canal is located below the jugular tubercle. Here, lateral border of basilar part attached to posterior border of petrous. Here is petrous, here is posterior border of petrous, and made this groove for inferior petrosal sinus. Laterally, when petrous part arrived to occipital part, made this foramen jugular at this area. Lateral to foramen jugular, here we have a groove, sigmoid groove. It is for sigmoid sinus of the brain. Here, in the occipital, in the squamous part of occipital bone, internal occipital protuberance, internal occipital crest, and here they are inferior occipital fossa for the cerebellum. They are superior occipital fossa for the occipital lobe of brain, and here lateral to internal occipital protuberance, we can see transverse groove for transverse sinus of the brain. Another structure in the posterior cranial fossa are the structures which are located in the occipital, in the temporal bone. The first, here we can see superior border of temporal. In the superior border of temporal, which is located in the posterior cranial fossa, we can see groove for superior petrosal sinus. Then the structure in the posterior surface of petrous. Here is posterior surface of petrous. The structure are internal apostygmatus at this area. Here, internal apostygmatus. Also, here we can see a slit-like fissure at this area, and this fossa which is named subarcuate fossa. Here is arcuate eminence, here is subarcuate fossa. Also at this level we have the mastoid part of temporal bone. In the mastoid part we have groove for sigmoid. Also at this area we have a small foramen which is named mastoid foramen at this level. Yes. They are structures in the anterior, middle, and superior cranial fossa. Okay, and posterior cranial fossa. As you can see in the foramen lacerum, when I see foramen lacerum at this area, also when I look at this area, I can see foramen lacerum in the inferior view, foramen lacerum in the superior view. Here, foramen ovale in the superior view. Here is foramen ovale in the inferior view. Here, foramen spinosum in the superior view, and at this area, foramen spinosum in inferior view. And foramen lacerum, here, foramen lacerum in superior view. Here is foramen lacerum inferior view. Another structure, hypoglossal canal. Hypoglossal canal is located in the superior view below jugular tubercle. In the inferior view, it is located below condyle. Look at here, it is condyle. It is tip of my pen. Yes?
Yes.
Okay. Jugular foramen. In the superior view, you can see jugular foramen. Also, inferior view. Yes?
Yes.
But here, foramen rotundum, I cannot see foramen rotundum in the anterior part because foramen rotundum is located in the depths of this area. It is open to posterior wall of pterygopalatine fossa. Here, superior orbital fissure. Yes?
Yes.
Superior orbital fissure which connects orbital cavity, look at in the anterior part, yes, here, orbital connect, orbital cavity to middle cranial fossa. Here is middle cranial fossa.
Yes.
Another part, optic canal, connect middle cranial fossa to, look at here, can you see,
Yes.
to the orbital cavity. Okay?
It's,
Optic canal connect orbital cavity to middle cranial fossa. Can I see inferior orbital fissure? No. Inferior orbital fissure, look at here, connect orbital cavity to infratemporal and also in the depths to pterygopalatine fossa. Okay? I say that laterally inferior orbital fissure, laterally connect orbital cavity to infratemporal fossa, but at the medial connect orbital cavity to pterygopalatine in the depths of this area. Okay?
excellent.
It was the features of the internal occipital view, of the internal view of the base of the skull.
Yes.
Stay here.